Hi, my name is Allison Pence. I'm a first-year student at Thompson Rivers University, enrolled in the Open Learning Veterinary Technology Diploma Program. Today I will be performing eye and ear examinations under the supervision of my clinical mentor, Dr. Sue Bullard, who is here with me now. My first patient is Pup. She's a 14-year-old domestic long-haired cat who is in today for follow-up blood work to recheck her thyroid levels after starting methimazole for hyperthyroidism. So I will start by testing the Manos response of both the left and the right eyes. Right is normal, along with the left. Her palpable responses are normal in both eyes. I do not have permission from my clinical mentor to dilate the pupils for the PLR. But for the PLR, direct refers to the pupil that the light is being shone into, and indirect is the other eye's pupil. Now doing the PLR test, direct refers to the pupil which the light is being shone into, and indirect is the other eye's pupil. Both tests are normal. I will now visualize the retina using the ophthalmoscope. I do not have permission from my clinical mentor to dilate the pupils, so I'm just going to be turning the light off in order to visualize the blood vessels, the optic disc, and the retina. There are no normal or abnormal findings in the visualization. Stop that now. I am now doing the PLR response. The direct refers to the eye which the light is being shone into, and indirect is the opposite eye's pupil. There are no abnormal findings in this test. Okay, I will now be performing a fluorescent dye stain test on Pup. I'm adding a dye strip to a sterile test tube and then adding saline solution to mix the dye. And then I'll be drawing the solution into a 1 ml syringe and removing the needle prior to administering the dye into the patient's eye. Just applying 1 drop into the right and to the left eye. The dye upon application travels across the surface of the eye and then down into the lacrimal nasal ducts, which appears as green nasal discharge on the patient. You can just turn the light on. I'll be using the blue light setting for this assessment. And there are no abnormal findings upon doing the fluorescent dye test. I am now doing the shimmer tear test. Typically in our practice we will perform this shimmer tear test prior to doing the fluorescent dye staining. So I will begin with taking a strip out of the package, and I'll be starting with the patient's left eye. And then waiting 1 minute for the test to complete. Has passed, and the reading is 15, which indicates normal tear production. I'll now be repeating this process on the right eye. And the test strip is being placed in the lower eyelid of the patient. 1 minute has passed, and this test strip is at 16, which also indicates normal tear production. I am now performing a tonometry test to check the eye pressure of Puff. Restraining the patient and applying too much pressure around the eye or under their chin and neck region can also cause false readings and indicate increased pressure.
Yeah.
The patient does not require any topical ointment today, so I'll just be applying sterile eye lubricant to indicate how you would instill drops into the eye. So I have the eye lube here. I will be applying a small drop to the patient's, under the patient's lower eyelid, like that, and repeating this on the right eye as well. I am now using an otoscope to visualize the tympanic membrane of Puff's ears. I will be starting with her left ear. The tympanic membrane is a light pink color. I have full visualization of the tympanic membrane, and there is no fluid buildup, discharge, or any other abnormalities noted in her left ear. I'll be repeating this step on the right ear. Again, I have full visualization of the tympanic membrane. It is a light pink color, and there's no redness, fluid buildup, discharge, or any other abnormalities in this ear as well. Lastly, I'll be demonstrating how to clean the ears of Puff. She doesn't require any ear medication today, so I'll just be doing the cleaning portion. So I'll start by applying approximately 1 to 3 ml into the external ear canal. Once the solution is applied, I'm going to massage the external ear canal to work in there. And then let her shake. And then the excess discharge, I'll be using a sterile gauze to wipe the external ear canal and the pinna. And then I'll be repeating this on the right ear. Again, 1 to 3 ml of fluid. Massaging the external ear canal to work the fluid into the ear, letting her shake, and then again taking a sterile gauze to wipe the external ear canal and the pinna, clean of any excess solution. Thank you. My second patient today is Mitzi. She's a 9-year-old female multi-poo, and she's just in for a general wellness examination, and I will be performing my second set of ear and eye exams on her today, again under the supervision of my clinical mentor, Dr. Sukwa Buller, who is standing behind me throughout this procedure. Okay, so we start by testing the menace responses of both eyes. I'll be starting with her left eye. And repeating on the right eye. The menace response is normal for both. The palpable responses are also normal. So I will now be doing the PLR test. Direct again refers to the pupil which the light is being directly shone into, and indirect is the other eye's pupil that the light is not directly being shone into. I'll be now checking the patient's eyes after applying the fluorescent dye. And both the left and the right eyes appear within normal limits. There's a very small amount of green discharge coming from the nostrils, which would indicate that her tear. I'm now performing a tonometry test to check the pressure of the eye pressure of the patient. 17, 18. I'll be repeating this on her right eye. The patient does not require any topical ointment or eye medication today, so I'll just be applying a sterile lubricant for Mitzi. I'll just pull down her lower eyelid and then place the drops into her eye itself and repeating on her right eye. I'm now starting the ear exam on Mitzi. Starting with the physical assessment of her pinna and the external ear canal. So her left ear has no masses, hair loss, redness, inflammation, or any other abnormal findings. And on her left side, again, no abnormal findings, no redness, discharge, inflammation, hair loss, or any other abnormalities. So I am beginning the ear exam on Mitzi, starting with the physical assessment of her left ear. Upon physical assessment, there is no hair loss, and on the pinna, there is no redness, inflammation, and in the external ear canal, there's no discharge, redness, inflammation, or any other abnormalities present. Repeating on her right ear, again, there is no hair loss on the outside of her ear. On the pinna, that appears normal, no redness, discharge, inflammation, or any other abnormalities detected, along with her external ear canal. I will now be using the otoscope to visualize the tympanic membrane on my patient. I have full visualization of the tympanic membrane, which appears a light pink color, and there is no fluid or discharge buildup or any other abnormalities upon assessment. Moving on to the patient's right ear, I'll be repeating the process again. Again, I have full visualization of the tympanic membrane, and there are no abnormalities present upon physical assessment. Okay. I'll now demonstrate how to clean the ears of Mitzi. She also does not require any ear medication, so I'll just be applying the cleaning solution today. I'm going to start by applying approximately 1 to 3 milliliters of the ear cleaning solution into the external ear canal, and then massaging the external ear canal to work the solution into her ear. And allowing her to shake to get any excess solution out. Good girl. And then with the sterile gauze, I'll be wiping the pinna and the external ear canal to clean out any debris and excess solution that was left behind. The process on her right ear. Good girl. Thank you.